Healthcare reform is coming, finally. Mike, let's talk about what this means in Chicago. First of all, start with the insurance market. It's a pretty unique market in Illinois, dominated by one big insurer, happens to be a nonprofit. What's the dynamic now?
Yeah, I think when you look at what the bill means for insurance companies, there's a lot of bad stuff in the bill. I mean, they're going to have to take all comers regardless of their health status. That could certainly raise the cost. A lot of insurance companies say it's going to raise premiums.
It'll be harder for them to drop people who have...
That's right. They're going to ban that practice of rescinding policies after the fact. There's a lot of things that could drive up the cost for insurance companies. There's also this big obvious, and that is about 30 million new customers nationwide, about 1.7 million in the state of Illinois. So that's a big opportunity for someone like Blue Cross, who already dominates the market with 60 to 70% of the individual policies. There's no reason why. I mean, they already compete hard for those customers now. They're successful, and there's no reason why, once this insurance exchange, this marketplace that will be set up in a few years, is up and running, that's essentially going to funnel new customers to them. There will be more choice and more competition from other carriers as well, and they can compete for those new customers just as easily. But Blue Cross is in a good position on the revenue side, at least.
On the patient side, is it going to be harder to get in to see some doctors?
Well, there could be an access, especially with specialty care. I mean, one of the things that this bill does, it's a big expansion of Medicaid. I think it's something like 400,000 or 500,000 new Medicaid patients could end up on Illinois' rolls. And what that means on the primary care side, those doctors are going to see an increase in the rates that they get paid for Medicaid. And that's always been a big problem. A lot of doctors don't want to see Medicaid patients because they don't get paid as well. They're trying to figure that out on the primary care side with new rates. On the specialty side, there aren't any enhanced rates, and that's already where the biggest problem is. So yeah, you could definitely see an access issue now that you have hundreds of thousands of new Medicaid patients with essentially longer waits to see, a gastroenterologist or someone to get a colonoscopy.
And then what about smaller business? I know both sides of this issue have tried to play the small business crowd off. What's the reality here?
I think it's likely that the smaller businesses, 25 and fewer, are going to see the most help. They'll qualify for tax credits. Even starting this year, there's a 35% tax credit for people who's, newly insured employees that small businesses cover. And then by 2014 is when the real help should hit for small businesses. They'll be able to buy into that marketplace. That spreads their risk to the point where they no longer, if you've got 10 employees and one or two of them get sick, you're going to get hit with a 50% increase. That should really cut that down. And so I think by that time is when you're going to start to see small businesses really gain from this bill. At the same time, there's a lot of small business groups that don't like the bill. 50 and over employees, that's still a small business. Those companies are going to be forced to recover their workers. Those are the guys who are on the fence. They may or may not be in a position to where they can cover them, and that could be a huge hit. That could be the difference between profitability and loss.
Okay. Thanks, Mike.